So I'm a mother of 3, and with my work, it's a bit unpredictable. In the hospitals, we are open 365 days, 7 days per week, 24 hours every day. So basically, there's no rest unless different people work. So sometimes it's quite unpredictable. And if you're not too sure what do I do, I'm an anesthesiologist. Basically, it means the doctor that always asks you what time you last eat. Okay? Because it involves with our field. Our job is actually to put you to sleep, give you no pain, and give you no memories of whatever things that happened during the surgery. All right? So because of the scope of my job, mainly I'm in the operation theater and ICU. So you can see me in church, but don't see me in the hospital. Because whenever you see me, probably not that great, yeah? All right? Okay, so the topic today that we're going to share about heart attack is actually not really my field. So this one is usually done by cardiologists. And cardiologists, they actually need to be a physician, a medical physician, internal medicine, and then they subsequently sub to be a cardiologist, right? But in my job, because currently I'm working with IJN, I meet them quite frequently, but more commonly I meet a cardiothoracic surgeon, which in the event that a patient can't be doing a procedure by a cardiologist, subsequently they're referred to a surgeon. So without further delay, let's start, all right? Okay, so how do you stay calm in a chaotic situation? So this is my daily work. It's in the operation theater. We call it a hybrid OT. Hybrid why? Besides doing an operation, we actually do scans as well, x-rays, simultaneously during the procedure itself, so that we can immediately come into a decision and what to do. So that's why it has the name of a hybrid OT. So in the moment you step into this operation theater, your life is my responsibility. So sometimes we argue with surgeon if we disagree. Whenever we think it's high risk, whenever we think it's not fit, or we think we can do better. So this is our job. We are the first person to step in and the last person to step out. And sadly, most of the time, the patient don't remember us or don't remember our name. But it's okay, as long as the patient is all right, yeah? Okay. So let me start with this. So if you're not too sure about Malaysian healthcare, it always starts with primary care, emergency care, and specialized care. So primary cares are all these normal clinics, clinic kesihatan. These are called primary care. The general practitioners, which my husband is, and my sister, okay, they're in the primary care. So they're better than me in primary things, meaning they give you a differential diagnosis where they think what are the common issues, and they'll give you the right referrals, okay? And then the emergency care, where the accident and emergency comes. Most of the time, this means a race over time, all right? So this emergency care, we usually call them the emergency physicians, right? They are the best people in fastest. Every year they have competitions on the speed of diagnosis and treatment. They can immediately identify, all right? And I really salute my colleagues who are working in the emergency physician, because I've stepped into an emergency department once in a while, and I think it's very chaotic. It's worse than the operation theater. Because in operation theater or ICU, I usually deal one-to-one, so I can give my 100% care. But in the emergency, it's not so. You can have one patient collapsing here, another patient collapsing, going to collapse, and then suddenly they will ring the alert bell, another one coming in an ambulance. So whenever there's a massive disaster, all coming together, they will alert everyone. So either the red or the yellow, those who are on standby from other departments, all of us are called down to the emergency department for massive disasters. Well, I'm in the specialized care, so I'm most of the time in OT and ICU. So in the OT, we have elective, which means well-planned surgeries, and we have emergency surgeries, which once you book for it, you need to be done within the next 24 hours, all right? And then we also have ICUs, which is also our field, where we actually take charge of the ventilators, which is the breathing machines. So most of our patients, we put them to sleep because we want to rest them and let them use less oxygen. So these main oxygens are for the organs, which is the brain, the kidney, the liver, so that and the heart especially. So this will support their survival better. They have the best chance, okay? So whoever that comes in the ICU, it's always the most ill patient in the whole hospital. And that's why our job is always 24 hours, non-stop. All right? Okay, so you want to guess or not? What is the cause of death in Malaysia? Top 3. Anyone wants to guess? Heart attack. Some more? Cancer. Some more? Okay, I'll give you a hint first, but this is in 2024. So the 10 causes, which in 2024, they can only take 2023's data. So same like now is 2026, we can only take a 2025 data, all right? So in 2023, number 1 is actually pneumonia, okay? Ischemic heart disease, which is the heart attack, is actually at the 2nd place, okay? 3rd place, cerebral vascular disease is stroke, okay? And then subsequently, the accidents and all. So if I were to break it down by gender, mainly for male to cause of death is IHD, which is ischemic heart disease. Whereas for female, it's actually pneumonia, quite surprisingly, right? Okay, so now if you were to look back, just now you all say about cancer, right? Is cancer? Yes, it's in number 5. Oh, sorry, this is only the lungs specifically. And breast is at 10. All right? So let's look back. How about ethnicity? Who do you think Chinese people mainly cause of death? Guess. Can you see? Not really, I think it's a bit blur, I'm so sorry. It's over here. Chinese is actually pneumonia. Okay? For Malay and Indians, it's actually IHD. All right? Okay, now, who wants to guess for 2025? What is the champion cause of death? COVID. 2025, probably not, but maybe 2021? 20, huh? Cancer. Some more? Stroke. Some more? Heart attack, accident. Okay, let's see. So the data came out. You are right, the champion is heart attack. Okay? But the 2nd place is still pneumonia, and the 3rd place is actually diabetic. So if we were to move back in 2023, if you can see diabetic, they are at the ranking of 8. So you can tell that diabetic actually chase up significantly over the years. And we may overlook that because most of us think diabetic okay ma, correct or not? It's not heart attack ma, it's not heart problem ma. But you see, and I'm not surprised that one day they may overtake it. And to be very honest, from our experience, diabetic is actually the cause for your kidney failure, for your heart failure, and heart attack. All right? So almost the same by gender or by ethnicities. But a surprising data for the causes of death by your age group. Okay? Young kids have been always suffering with pneumonia. Because whenever they are sent to preschools, schools, institutions, commonly they have URTI, and that's where the spread of it is very fast. And that's why we are worried, all right? Okay, but this falls under the public health, which those that control for dengue, TB, that is why whenever they need to quarantine, they will quarantine. The families, whenever they investigate one person in the family is involved, the whole family members need to go for a routine test, all right? So for 15 to 40 accidents, I guess we know why, right? Young chap, having new car, new motorcycle, going up to have some adrenaline rush with friends, okay? All right. Then 41, 59, majority of us are in this group. I am in this group. So ischemic heart disease is actually very common, right? And lastly, the elderly's pneumonia. Basically also means their immunity is lower, right? So in the healthcare, actually the most important people is not necessarily just the doctor. It's actually a team. Whenever I work, I can't work alone. We need a team. So the team mainly consists of the doctors, nurses, and the medical staff, which is the medical assistant. So besides the nurses, we have medical assistants as well. These medical assistants, they can be supervised in different fields. For example, imaging. For example, checking our machines. For example, preparing drugs and all. Right? So now, I'm not too sure any one of you are aware about BLS and ACLS. BLS is called Basic Life Support. ACLS is called Advanced Cardiac Life Support. Right? And why do I say time is very important here? That's why one of the theme is the time, right time. Everyone may not know this, but for cardiovascular event like heart attack, there's a golden time. So in IJN, we have a door to balloon time, which means the moment you step into the emergency department, the moment they detect you're having a heart attack, they get you in the lab and make sure the heart get reperfused within the 90 minutes. That's our KPI. Okay, and I'm proud to say for the past few years, it has been above 90% achievement. It's not easy. It's really not easy. All right? So, if you really think highly is heart problem, you must find the right hospital. Because not every hospital is equipped with a cardiologist and a cath lab. Cath lab is something like the something like the operating theater that I showed you just now, but they cannot do operation inside. So in KL Center, you are very, very privileged. Because KL Center, I think just within this radius of 10 kilometers from church, you have more than one choice. Private, government, you got more than that. But for districts and other states, you will be surprised. Sometimes the whole state, there's only one hospital. So to have this knowledge is actually very important. All right, next is stroke. Lisa want me to share a bit on stroke as well. So it is actually a very, very good topic because it's sort of related to heart attack as well, and later you understand why. So in the stroke, there's two types of stroke. One is bleeding, and one is a clot, or that stop the blood supply. So for clots, we have something called a stroke protocol, which also means the moment you step into the emergency department, and if the emergency physician comes up with the diagnosis of stroke, that is usually showed by a CT, confirmed with a CT brain, they need to activate the stroke protocol, which means you need to get perfused in less than 4.5 hours. And to tell you, to get the operation theater, to get the lab, to get the respective people, sometimes it's not so easy. And sometimes it doesn't come in one, it comes in pair, 2 or 3 or 4. And how are we going to keep up? We always choose who is more severe. So don't get upset if sometimes you're not chosen, but it actually means that probably you're not that severe. This is in the government setting. Because in government setting, the equipments and stuffings are limited. Okay, then next, if it's a brain surgery, we'll try to arrange within 6 to 12 hours. Okay, so in the nearest to us will be HKL for government hospitals. For private hospitals, you are spoiled for choices. You have KBJ Tawaka, Sentosa, Puswari, Glen Eagles, yeah, a few more, right? Okay, next, cardiac arrest. So cardiac arrest, time is the key actually. And this key is actually not on the doctors or the ambulance or the hospitals, but it's on you all right? And if you, as a public bystander, you don't know what to do, the least you could do is either call for help, find an AED. If you don't know what is AED, is an automatic electrical defibrillator, all right? It's something like a suitcase, a box. Anyone can use it, trust me. If you don't know what is it, you just need to open, they'll tell you number 1, number 2, number 3, instructions. And all you need to do is actually just open up and stick on the patient and do nothing. Then just on the button, the machine will tell you what to do. The machine will say, we're gonna shock, get away from the patient, or they will say, start your CPR. This is what AED does, okay? So they will do, and whenever you do a CPR, it's at every 2 minutes cycle. Right. So this is the basic life support chart, or in short, we always say you just memorize doctors, ABCD. Okay? So D stands for danger, R stands for response. You check whoever that collapse, do they have a response? Danger, you actually means take them away from whatever area. Okay? S send for help, call ambulance or make a call. Anyone know in Malaysia what number to call? Yeah, 999, very good. If you don't remember, don't worry. I got tips and tricks for you later. All right? And then you got A for airway, which is just to lift up. What happens is when you lift up, you notice the tongue move away, so you can breathe better. Sometimes you cannot breathe, right? You will do like that. Easier to breathe. That's what we do, okay? So that the oxygen can go into the patient. So basic science, in this normal atmosphere we call, there's 21% of oxygen. All right? So whenever you give patient oxygen, every 1 liter adds about 3 to 4%. So some people last time, COVID time, we have this oxygenator regulator at home, right? You put 4 liter, 5 liter, yeah. So that's how you increase the oxygen, right? Then you have B, check breathing. So usually you see the movement. Is it breathing? When they breathe, left, right, equal or not? Or one side low, one side high, then you can know, all right? Then C is where you start the CPR. Anyone knows how to do CPR here? Ah, very good. No, don't worry, okay? CPR or whatever is same like driving. You go into a different car, but the moment you start the engine, everything will come back. Correct or not? So it basically means your hand have to put where? Position of the heart. Do you know the position of the heart? Yes, it's over here. If you're not too sure, it's in between the nipple lines, okay? So that's where you just straighten your hand and start pressing. That's CPR. Okay. Then finally D defibrillator, which means you need an external, we say an electrical therapy. Basically to like jumpstart the engine, jumpstart your heart. You know, sometimes our car lights on and then the engine gone, you have to jumpstart. So this is what AED does, okay? So if you were to see, according to the AHA guideline 2025, the 6 steps on the top, it's now the golden key to a survival of a patient. And you notice the first 3 is probably not determined by doctors or not the hospital. It's actually what you do outside before the patient arrives to the hospital. So the chances of you all doing this, the first 3, which is the recognition, you activate the emergency call, you do a high quality CPR, and if you got an AED, you shock, the chances of that person being alive and survive is higher. Because by the time they come to the hospitals, if it's too late, there's nothing much we can do actually. So my job depends on you all actually. Okay? So this is where we come up with a chain of survival. Because only if you do the first 3 steps correctly, I got the next 3 steps lah. Correct. Then only I can give advanced resuscitation. We can carry them in the ICU first, buy time for them to recover. And lastly is for their survival and recovery, where the physiotherapy and the family support comes. And do not look down on the last part. the family and the rehab and the physio actually play one of the most important part. Right? Yes, we can hear that. Yeah. So whenever we say types of heart problem, everyone only think about heart attack. Correct or not? Actually, it's not so. So in the heart, there's many components. One is the blood vessel. One is the rhythm, which is the jumpstart thingy. That's called rhythm. And the structure or the myocardial condition. But for structure and myocardial conditions, usually is an inborn issue, congenital issues. Okay? Those kids that are born with heart problem, hole in the heart. Hole in the heart can be ASD or VSD. ASD is atrial. The heart has 4 chambers. Okay? On the top part is connect right and left. And the lower part is the right and left as well. So when both sides are not supposed to communicate, okay? Means the right will pump to the right, then the left will pump to the left. But when they have communication, that means there's hole. That's where the congenital heart disease comes. This is hole. So from my practice, hole is actually a small problem. Because now can easily be treated. Okay, what they do is they just need to patch and close the hole. No problem, correct or not? And the best part is the technology is so advanced that now you don't even need to do a heart surgery. There's something that goes through like how you do an angiogram, and they just put an umbrella and seal it. That's how technology is. Okay? But the more complicated one that we have seen now, besides the heart problem, the holes, there's actually valve problem. And the pipeline, we say wrong pipeline. In normal, they go to the lung to get oxygen and then subsequently pump to your body. The whole pipeline wrong. So basically, it's a major procedure. And most of the time, this happens in small kids. Small kids, I'm talking about 3 kilo, 5 kilo, less than 10 kilo. Right? Okay, so mainly, as we grow older, the main problem will be the blood vessels and the rhythm. So the blood vessels are what we call coronary, which is the blood supply to your heart. Got blocked. That's very common. Okay, angina, which the pain only comes when you stress yourself, when you're doing exercise. That is called angina, actually. All right? And then you have heart attack, where the cells of your heart actually die off. Totally have no flow. That's called a heart attack. Right? Then you have the aortic disease, which is commonly in those who don't control blood pressure. What happens is your vessel walls get thinner and weaker. They expand, and they started to bleed. Okay? So heart rhythm, you have atrial fibrillation, which is the heartbeat is 130 to 140. When the heartbeat is this fast, there's no time to rest. No time to rest, the blood flow cannot go into the heart. Hence, there's nothing to pump out of your heart. So this is what happened. Okay? Then you have tachy, which is very fast, commonly very fast. It's according to the beat, like how you see sometimes the drummer, praise and worship, it's fast. But it gives your heart a lot of stress. And this actually relates to thyroid problem. You know thyroid? Someone suddenly say, oh, you lose a lot of weight. Oh, you might be very happy, but you probably want to check your thyroid hormone as well. Okay? Then next you have bradyarrhythmia. Bradyarrhythmia is where the heart beats so slow. Pop, 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 so slow. When it's so slow, what will happen? Your heart's response. So this kind of patient actually on and off, they will faint. All right? So these are the main things. So what are the tests? So this is what I always encounter. I ask my patient, you check your heart before or not? Yes. They say, I checked before. Doctor say no problem. So in the end, I found out they only do an ECG. So ECG is what they place on your chest and they check the impulses, which we are more commonly understands, right? But honestly, it's probably not that sensitive, which means a good a normal ECG doesn't tell you much that your heart is good or bad. All right? And if you want to be very specific, you actually need to do a few or combination of tests, which includes an ECG, a blood test, and an echo. All right? So there are also tests that are therapeutic, which means can treat, and there's also tests that can diagnose immediately. And this is the best actually, angiogram. Angiogram is where they cannulate on your, okay, if you feel here, you can feel your pulse. Can you feel your pulse? It's at the thumb side. Okay, we call this radial. So radial artery is here, you'll be able to feel that pulse. So for cardiologists to be able to check your vessels or your blood supply, they actually cannulate here, radial, or your femoral, which is your thigh, here, two SS. They go in together, follow the flow of your blood vessels to see how is the condition. And they'll inject a contrast, which is a dye that we can shoot immediately and see the flow. So angiogram is actually the best, but it has a bit of disadvantage. The contrast is harmful for the kidney. So if not needed, we don't advise you to do angiogram. Unless we are highly suspecting something, then it's worth to go for the angiogram. Right? So some people nowadays are reverting to this cardiac MRI, which is easy. You just lie down, go into a tunnel, shoot some picture after 30 to 40 minutes, and then come back out. That's all. All right? This use contrast as well, but the contrast is more friendly. Won't damage the kidney that much. The only thing is some patients are phobia, get into tunnel, not to move for 30 minutes, cannot. Right? So this is the biomarkers, which is able to tell you from the blood test. And they will only show when you have a heart attack. If you don't have a heart attack, most of us are normal reading. It's only during that moment you have a heart attack, the cells break down, which are your cardiac cells break down. This is where you have the reading higher and tally with your ECG and your symptoms. Okay? We need to have 2 out of the 3 criteria. Okay. So what are the treatments available in Malaysia now? We have angioplasty, or sometimes we call it stenting, which is PCI, percutaneous, which means just do an injection, and then we can enter the guide wire and whatever needs to be put in. Okay? And the clot busters, remember I mentioned about certain hospitals has no cath lab and all, so they have no options to do an angioplasty or stenting. So they can only give medications which help to thrombolyze, which means to dissolve the clot. But the disadvantage of this thrombolysis is sometimes you also cause other areas to bleed, for example, your brain and all. So if you were to be treated for thrombolysis, they need to observe you in the emergency department, and they need to frequently keep on testing you. Okay? Because they want to see any new changes. And last but not least is a bypass surgery. Coronary artery bypass surgery is what I do every day. This is where the cardiologists think that it's not worth for you to do. For example, you got 3 vessels blocked. Each vessel block, the stent costs you, I'm not too sure, about 10, 20 maybe. So 3, you get 60. And the outcome is probably not guaranteed. In this kind of condition, your cardiologist will advise you to do a bypass surgery. Bypass surgery basically means finding a shortcut or finding a new way for the blood flow, which has very good outcome. They can last you 10, 20 years. If you do a stent, the chances of this stent get blocked is very high if you are a smoker, if you don't take your blood thinners. So it's a bit probably higher rate for recurrence. But the good thing is the initial procedure is less invasive and it's less painful, faster recovery, right? Okay. So this is how an angioplasty does. Remember I said about the guide wire and all? So through the through the show of the angio, we will be able to see where these places are. So when they shoot the contrast, they will see where's the block. So the cardiologist will put a balloon to make a path, and then subsequently they'll launch the stent. Once this stents open up, your blood flow regains. That's where you get reperfusion to the heart. Okay? All right. So if you can't do the procedure, this is what I mentioned, blood thinners. They're different group, but I don't think I can share all. The other one is beta blockers. They basically don't make your heart pump so much so that they decrease the oxygen demand. So you have more oxygen, the heart does not fail so fast. So most of the time you have beta blockers. Beta blockers, I always remember as laughing out loud medicine, LOL. So whatever drugs that ends with the LOL belongs to this group. Bisoprolol, atenolol, metoprolol, it's all the LOL that makes you laugh out loud. Okay? All right. Then the last one is statins, lower cholesterols. So there are some evidence-based now that if you have a strong family of heart disease, high cholesterol, to a certain age, you start statins already. Although now you're not symptomatic, but your cholesterol readings are high, probably you should start. Statins are very easy to eat at night. You eat on the night time before you go to sleep. Okay? Right. So I have this QR here if you want to scan. So this QR will bring you to this IJN Care. So IJN now is the only only hospital in the country that has all informations in digital form. All our records are in digital form. So that's why we can act fast. Whatever blood results you do in the emergency department, you just give a call. We are in the ICU, we know everything already. So this is what you can have. So if you have the app, you'll be able to scroll behind. You'll be able to see the emergency call number. And also, if they have this one, heart attack hotline. It's also in the app. So you'll be able to call and they will get the first ambulance. So the first ambulance in IJN, the moment you're in the ambulance, they plug you on for the ECG. This ECG immediately transfer to IJN's ED. So that's how they alert the team in the cath lab, because everything is actually about preparations. They will prepare everything. That's how we beat the time of 60 or 90 minutes. Okay? So now we move on to stroke. Okay, before we move on, maybe everyone just stand up for a bit, stretch. Really? That stress? All right? Okay, good. Feel better? Okay, come, let's continue. You can sit down or you can stand up and answer a few questions. So usually when I do presentations, I know my target audience. It's either nurses, doctors, or students. But today is a big mixture, so I'm not too sure. Some people may think it's very easy, some people may think it's very difficult. Let's see, yeah? So there's 8 questions, A, B, C, D. You can just write down anywhere or just remember in your mind. So name a type of stroke. Which kind of stroke do you know? What kind of strokes? There's only one answer. There's only one answer, huh? Okay. A, okay, let's see. Name a common symptom of strokes. What do you think is a common symptom? Very good. Name weakness. Next, name a risk factor for stroke. What do you think is a risk factor? Very good. Smoking. Next, state one potential impact of a stroke. What do you think is a potential impact? Inability to walk, yes. I wish it was increased intelligence, but no, it is not. Okay, state a type of therapy for adults after stroke, which supports recovery. Very good, physiotherapy. Actually, among our church members, there's physiotherapists as well. Okay, name a heart condition that increases the risk of stroke. Cardiac arrest. It's actually atrial fibrillation. When the heart pumps too fast, there's not good blood flows. Means inside the heart, the blood keep on flowing like that instead of passing out. So when it happens like that, we call it a turbulent flow. Turbulent flow is what causes the small clot to happen. So they are at higher risk. So when this clot is there, then suddenly the heart pump back normal. So they pump out this clot to other organs. Yeah, okay? Next. Name one method of diagnosing a stroke. Very good, CT scan, right? Okay, so now we know everything about stroke. The answers we know already, yeah? So I'll just skip this part. I'll go into a simple introduction. So for stroke, I happen to work in HKL. HKL has the biggest neurosurgical department in the whole country, all right? So they train all the neurosurgeons from there, and we actually deal a lot with the stroke. But I'll just explain to you what's the difference in finding the right person, okay? Why? Different doctor, if you find wrong doctors, they can't solve your problem. And why is it so, we'll say? So a stroke is when the blood supply to the part of the brain is cut off. Actually, it's the same with the heart. When the blood supply is cut off, you have a heart attack. Okay. Oh, sorry, too fast. So this is actually the blood supply of a brain. Okay, if you see the vertebral artery comes all the way from your spine up. Okay, basilar artery is the posterior part. Okay, and then inside the brain is where the posterior cerebral artery, communicating arteries, middle cerebral arteries, and anterior cerebral arteries. Okay, why do we need to know that? Because if you look at this picture, it's in a circle. And there's a name for this, we call it the Willis circle. So, the good thing about stroke, why stroke take 4.5 hours, but heart attack only 60 or 90 minutes? Because there's communication. So whenever the left is affected, the right will try to help and supply. That is why they have a bit more time for stroke patient. Okay? Now let's look. What types of stroke we know? So actually, generally we see it as stroke, but it's actually two types and two totally different management. And sadly to say, these two is contradicting to each other during the emergency period of time. So the first one is ischemic stroke. When the blood supply is cut off due to a clot blocking, there's no supply. This one, you find a neurologist. Neurologists are internal medicine, subspecialty neurology, which is the brain. They will treat the best because they integrate the best CT. They integrate the best area of your brain that is affected. So they have the most experience, right? But if it's due to a bleeding in the brain, which is also stroke, but it's called hemorrhagic stroke, you need to find a neurosurgeon actually. A neurosurgeon is a surgeon. Last time in Malaysia, they used to be a general surgeon, and then they sub into operating on the brain only. But nowadays, they are allowing them to do some parallel pathway, which means they straight away go in and specialize in the brain. They are surgeons. Okay, so this is a CT. Do you think, which type of stroke is this? Anyone knows? Guess. Hemorrhagic? You think it's hemorrhagic? It's actually infarct. This is an infarct. What happens is that there's no blood supply, the tissues all die off. So you can't shoot any pictures, as in you can't see anything. This is actually a bleed. When there's very drastic color. Why? Because water is more dense, heavy. So you can see it's brighter. If you see this, it's not a good thing. Why? This line already shift. So means not just one side of the brain is affected, but probably the whole brain. And in this, it can be only done surgery. Why? They open up the skull, give chance for this pressure to move so that they don't affect the other side of the brain, right? So what are the symptoms of a person having stroke? So the good thing about be it hemorrhagic stroke or be it infarct. All right? Ischemic stroke, both of them has the same symptoms because it actually depends on which area of the brain is affected. Okay, you have the arm or leg weakness, slur speech. Suddenly you see the elderly eat and then drool one side. It's actually early sign. Or suddenly eat and keep on choking. Those are early signs as well. Okay? Then you have some facial weakness. You suddenly see the eyes cannot open one side. And this fold, we call it the nasolabial fold. They'll lose that fold here. Okay? And then you have vision changes. They will say suddenly either they cannot see half, cannot see, or totally spots or other different things. Okay? Right. So the funny thing about the brain is it's ipsilateral. Ipsilateral means the right control the left control the right. Right? So if the right is affected, you know which is involved. The left side of the brain. Okay? So this is where, and the area that they affect determines what is the outcome. Whether it's a slur speech, whether it's comprehension, means some of them can actually understand. Stroke patient, they can understand, but they can't express it back out. Right? Okay. So what are the risk factors? Cholesterol, same thing as a heart attack. Because it's all about the blood pressure, the flow. High blood pressure, uncontrolled diabetic, alcohol, smoking, these are commons. And also arrhythmia, atrial fibrillation. Okay, so the diagnosis is same, check for ECG, check for regular blood tests, CTs, MRI. And finally, the treatment. Now this is where you need to find the right person. We mentioned just now there's a difference between a neurologist and a neurosurgeon, correct or not? So there's actually a procedure, thrombolysis or thrombectomy for stroke, which is the ischemic stroke, the one that stops the blood supply. A bit like the cardiologist technique, they put a wire and they put a balloon, but it is done by an interventional radiologist, which is of a radiologist background, and then they sub into interventional. Only they can do. The cardiologists, although that's what they do, they can only operate on the heart area only. So that's why international radiologists in whole Malaysia, the amount is less than 50. Not many areas have. And you're lucky because HKL is also the training ground. So our church and whoever that stay nearby here, we are very blessed because you are at the center of excellence. Okay? And the best part is a government hospital. Okay? Right. Psychological therapies and medications, as what we mentioned. So I'll go fast a bit. Warning signs. We always remember as be fast. Means you don't wait. If you see something, don't say, wait for my son to come back, wait for my daughter to come back and bring me to hospital I'll wait for someone Just get a Grab, go to the hospital. You can call them along the way. Okay? Or if you think that person keep on denying, just help if they show this kind of signs. Have balance difficulties, eyesight problem, facial weakness we mentioned, arm weakness we mentioned, speech difficulties, and T, which tells you it's time to call for help. Okay? So this is the burden of stroke in Malaysia, and sadly to say, 3 out of 10 only will get a survival, good surviving, which means probably they're not back to their usual self, but at least they can take care of themselves. So it's only 3. We hope that one day we can exceed it, at least 5 or 6 out of a ratio, right? So you want to know whether you're at risk? Check back on all this. Do you have high blood pressure problem? Do you have cholesterol? Do you have diabetic? Are you a smoker? And some of things are we call non-modifiable factors of your origin or ethnicities. This one we cannot control, okay? And your family histories. So you can only modify what you can, which is smoking, alcohol, diets, lifestyle, right? So how do you treat? So for ischemic stroke, we mentioned just now, either by medication, same, blood thinners, by procedure, which is by the interventional radiologist. You remove the clot with a stent retriever. Another one is a procedure where you operate on the main vessels to your brain here. the carotid. This is where you feel the pulse. If you put your finger, you will be able to feel your heartbeat. Pop, pop. This is the main supply that supplies to your brain. So sometimes the blood clot happens here. And when your blood pressure is high, for example, you're angry at your kid, woof, this is what happened. It will dislodge the plaque, and then you have a stroke. So whatever it is, no need to be angry at anyone. No need to raise your blood pressure for your own sake. Okay? Yeah. And angioplasty we mentioned. So hemorrhagic stroke is where the interventional comes, using the hybrid OT as well. You can do coiling, and you can do surgical removal as well. Stereotactic radiosurgery is actually a new form of surgery. It's very expensive because it's a very minimal incision. What they do is, when the surgery of the brain, they scan to get the exact precise position of the vessel and then put a needle in and do whatever procedure they want. It's very, very specific and very accurate. Any discrepancy of 5 mm, have to restart the whole thing again. So this is what my neurosurgeons have been doing in the operation theater, and we all can just wait, and make sure the patient is all right. Okay, so I'll show you something that is probably not very well known. It's called an arteriovenous malformation. So if you hear suddenly young kids collapse in the school, suddenly pass away with no health issues and all, commonly are due to this, which we have seen. I've seen a few cases when I was practicing in HKL. These are young male chaps. So what happened is they don't know they actually had abnormal blood vessels. So if you look at this picture, it's the normal. You have the capillaries, which is the bridge between an artery. Artery bring oxygen-rich blood, and the vein is where the blood's taken up all, the organs taken up all the oxygen and then return the blood back. Okay, this is how the process is. So in AVM patients, it's actually abnormal. So the vessels here, they have many, many abnormal branches, and they are easily burst or ruptured. So what they can do is, if this is diagnosed early, they can actually inject some medication, or actually they can stop the blood flow. So this area, once you don't have blood flow, it will eventually die and close up. So that's how they can be safe, right? So that's the difference. So for patients with stroke, the early signs is vomiting, blurring of vision, hearing some weird sound, okay, and probably not themselves, besides the B fast that we mentioned. Okay, so you can scan this QR. I managed to find this. You bring you to this web page. It's called My Stroke Hospital by Malaysian hospitals. If you have, you just find a place where you want to find a location. So if you're for family, friends, suddenly you come to one area, you don't know what's the nearby hospitals. You just write, and then you come up the name of the hospital that's nearby you, the distance. Okay, that's all for, yeah. Oh, I exceeded, sorry. Yeah, so now is a Q&A session. I'm not sure I can answer all your questions, but I'll try my best. Okay? Anyone want to ask? Yes. A pacemaker. Okay, so just now we mentioned about the heart, the rhythm of the heart, where it can be fast, can be slow, right? See. So basically, pacemaker is a machine, a mini machine that's put nearby, either most of the time on your left side of the chest or the right side. And those who have used and changed many, some of them put near the abdomen area. So this machine has wire that wires to the heart. So they sense. So certain days your heart can go normal, certain days your heart go fast. But they set at, usually the cardiologist set at 60. If your heart rate drops less than 60, the machine take over. they fire, then your heart will sense that fire, they will start contracting. So that make sure you have sufficient blood supply. So there's two types of pacemaker actually. One type is just pace to jumpstart your heart. Another type has an additional function like how a defibrillator does. When you have a lot of abnormal rhythm, besides the fast one, the one that cannot pump out, they will shock your heart. So you don't need an AED. So I always say patients with this kind of ICD, we call it internal cardiac defibrillator, can live very long. Yeah, because they sense it. Before you know, the next thing you know, I gonna shock inside. And when you shock, this machine actually deliver the information to your cardiologist and your technician. They'll immediately give you a call. What are you doing? Are you okay? Or they will alert your family and say, you need to send who to the hospital. So the good thing about modern is we have a smartwatch. If you have a smartwatch, I think it's quite cheap, 50, 100 you can get. You can actually know your heartbeat. Today, 50, 60, suddenly, I'm not doing anything, why is 100? It's actually abnormal. One of my friends actually found this and went to the hospital and subsequently only checked and found out that he has a heart problem, rhythm problem, which is inherited. Okay? So the pacemaker, usually they check every 6 months, and the battery lifelong depends on how often you need it. So if they put it in, you only use it maybe 1 year once, the battery can last you up to 5-10 years, maybe. It depends on the volt as well.
Thank you so much, Dr. Melissa, for a very insightful talk.